The information presented on this podcast represents the personal views and opinions of the hosts. The Neapolitan Trifecta podcast is not and should not be viewed as a news source. The ladies will often discuss current events regarding women in the entertainment industry. Links to sources of information will be posted for reference.
Okay. Welcome to another episode of the Neapolitan Trifecta podcast. I am Lana Reed. I'm a director and the owner of Garnet Films and an aspiring actor.
Yes, I will tell you right now, Lana is acting in a film. I'm in it with her, and I'm so excited because she's hilarious, by the way. I am Nancy Pushkar. I am the owner of Crazy Cat Lady Productions, Paw Power for all animals, and I am an actress, so I am doing some writing as well. So we're going to toss it on over to our friend Alex.
I'm Alex Schumard, an actor based out of the Dayton, Cincinnati general area, and definitely Paw Power.
Definitely Paw Power.
Okay.
Well, Nancy, we got someone very special today.
We have to get in our Paw Power and all that kind of stuff.
Paw Power.
But anyway, we have somebody fantastic with us today. I'm so excited because we have the high energy Jenn Seley with us today. She's amazing. I'm going to tell you something. This woman has more energy than anybody I know because she has an incredible job where she works with kids. She's a music therapist with Cincinnati Children's Hospital.
Awesome.
Which is fantastic in itself. But the work that she does is unbelievable. And one of the reasons why we wanted to bring Jenn on the show is to introduce to you again another aspect of things that you can do if you have a desire to be a musician or work in the entertainment industry. This is another thing that you can do, another opportunity for employment where you can do the thing that you love best and do something fantastic with it. So Jenn is going to talk to us a little bit about what it is like being a music therapist, what things she does with the kids, because she works predominantly with teenagers and young kids. And she's going to go from there. We're going to have some questions for her. And she will, at the end, will also give you any information on how to contact the association to find out what it would be like, what you'd have to do to become a music therapist. So Jenn, take it away. Give us a little history on who you are and what's going on with you.
Absolutely. So as the ladies have said before, my name's Jenn Seley. I'm a music therapist at Cincinnati Children's Hospital. I primarily work in the mental health setting, so working with kids and adolescents who are dealing with different mental health issues in their lives. Depression, post-traumatic stress disorder, psychosis, schizophrenia, things like that. And basically, I have a really cool job. I get to use music to help them in their lives and help them get through their treatment and basically just make their lives better. Really, really cool profession. A lot of times people hear the words music therapy and they get a certain image in their mind, which may or may not be what music therapy really is. So I found one thing that's really important when I'm talking with people about music therapy is to just help people understand what it is and maybe a little bit of what it's not.
Definitely, yeah.
So the idea of music therapy is that people who are music therapists are using music and a therapeutic relationship to help the individuals they're working with make their lives better. So in the mental health setting, that may be working with kids to express themselves safely. It could be working, if you're in a hospital, a traditional medical hospital, might be working with somebody in cancer treatment on pain management, using music to help decrease their perception of their pain. I have experience working in special education settings with children and young adults on the autism spectrum. So a lot of times I was working with them on academic concepts through music, self-regulation through music, things like that. So you could talk to 15 music therapists and you would see 15 different ways of doing music therapy.
Right.
But at the heart of it all is the combination of music and a therapeutic relationship to help the individuals we're working with get to a better place in their lives.
Yay, awesome. And I've seen Jenn in action, and she's phenomenal, absolutely phenomenal. And the thing that I think is really important is that it's a process as well.
Exactly.
You don't just go take a guitar into a kid or some type of percussion instruments and say, hey, let's just do this and see what happens. You have a plan. You understand what the diagnosis is that patient has or that kid has, and you work through a lot.
Absolutely. A lot of times the words you'll hear people colloquially say, music is my therapy. And I think that speaks to how strong music impacts
For
all
sure.
of us on a daily basis.
Definitely.
But it does add some confusion when people are trying to understand what music therapy is. So sometimes people think, oh, well, you can just walk in and you can turn on an iPod and that's music therapy because that music's helping a person feel better. But the actual profession of music therapy goes deeper than that. As Nancy said, it involves understanding the person's needs and their strengths, maybe if they have a diagnosis, and learning how that impacts their day-to-day functioning. All music therapy is based on an assessment of some sort, so that is looking at where the individual is that day, what their overall level of functioning is, what they're capable of, and then figuring out how we can shape music experiences to help them reach their greater potential.
Right. So tell us, how do you decide? Now, I know that a lot of people will say to you, oh, gee, Jen, this kid loves music. Music is their life. They listen to music all the time. They said it's really important to them. How do you decide which patient will do better with a therapeutic intervention with music as opposed to
Right,
a
like
patient that
benefiting
just
from it.
needs to listen to some music to just help them while they're doing their homework?
Yeah. And that again comes back to the idea of assessment. So being able to go in, talk with a kid, maybe do a brief interaction with them musically and see what they respond to. If they seem like music listening is enough for them, maybe I provide some guidance on what listening is going to really be the best for them. Or maybe an individual is quite insightful on what they need to listen to, and I just let them go. But I personally, as a therapist, tend to have a very interactive style. A lot of the therapy I do is actively making music with the kids and adolescents with whom I work. So that is one way that I prioritize. Do people need that interaction, and maybe they don't have the music skills to do that, so I need to be there for that. Maybe they have other psychological things going on. If I'm working with an individual with depression, maybe they don't quite yet have the motivation, the intrinsic motivation to do it on their own. So then part of my job there becomes using that therapeutic relationship to build up their motivation to engage in the music,
Right.
to then help them further reach the goals that they want in their life.
What an amazing process to be a part
Yeah,
of.
seriously. that's
Engaging with
beginning to
someone
end,
through
yeah.
something so creative as music and watching them transition and grow and blossom into a different person.
Absolutely. I do work with a lot of youth that have had adverse early childhood experiences.
Right.
They've experienced some sort of trauma, abuse, things like that in their early life. And it makes it hard for them to trust a lot of people, especially adults,
yeah.
if the perpetrators of their abuse or their adverse childhood events were adults. But so many kids and teenagers have this connection with music. And so to be able to bring in something that they generally feel is pretty safe, and then to learn how to work together to create music.
Right.
Yeah.
And to gradually help them understand that you can trust people through music, really working on the teamwork that goes along with making music together, the relationship piece of that. I've seen so many kids bloom and blossom in that aspect. They go from totally shut down around adults and not wanting to open up at all to by the time their treatment's done, we have a very strong therapeutic rapport. We can predict each other's moves musically. We know what's going to happen. We know when to hit beats at the same time as we co-create music, because that relationship has blossomed, and it's all come through because of the music.
Yeah. So, being in this line of work, how do you think it has changed you as a person, interacting musically with all of these young kids?
It has, first off, made me appreciate so many different kinds of music.
Well,
Right.
Yeah.
Yeah.
Definitely.
Growing up, I listened to the same few kinds of music. That's just what I was interested in.
Right.
And then when I started working as a music therapist, suddenly I had to understand all the different kinds of music that all my different clients connected with. And so although heavy metal is not the music that I grew up listening to, and maybe I don't emotionally connect with that,
Right.
when I was working with a youth who loved it, I had to be able to understand what it was about heavy metal music that drew them in. And so I think being a music therapist has deepened my appreciation for so many different kinds of music, understanding what it is that helps people love maybe gangster rap, which I've definitely developed an appreciation for as an adult, something I did not listen to growing up.
Right.
And seeing how positive it can be and how many people that I've worked with have responded so well to it. It's deepened my appreciation for that.
And you struggle with that because I know as myself, I really struggle with censorship. And I know that you have to be very, very careful when patients or clients request to work on a certain type of song with particular lyrics that are not appropriate, as we say. But you make it happen, and you still show them that you respect what they like to listen to. However, we have to work with it differently.
Absolutely. And that's going to vary setting to setting, facility to facility. The facility that I work in, we have a lot of rules around what our kids can and can't listen to based on the therapeutic needs that they have.
Sure.
If I was working in an adult setting, I think the censorship might be a little different.
Right.
And again, that's where it comes back to assessment. Me being able to look at an adolescent, if it is an adolescent who maybe just likes to try to push the rules, maybe that validation of, your music is absolutely great, but you have to understand where we are and that we just can't sing those particular lyrics here. That can be a learning experience for them. Now, on the other token, I might be working with a child who has a lot of pent-up anger issues. And sometimes the most authentic way to
Let it
explore
out.
that is with lyrics that maybe are inappropriate. So again, it's assessment. Me as a therapist determining, is this clinically appropriate? Is this a kid who's just trying to bend the rules to see what they can get away with? Or is it genuinely a therapeutic need for this?
Right.
Right, and that's all about being part of that process of really determining what's going on deep down, for sure.
Can you tell us about, we had Suzanne Matthews from the Seacrest Studio on, and she talked a lot about what the studio does. Now, I know you have introduced some of your clients to the studio, which
I bet that's
was
game changing for them.
absolutely
That's so
phenomenal in terms of self-esteem and everything. Could you tell us about that? Because it makes the hair stand up on your
Yes.
head.
I know,
like in the best way
goosebumps,
possible.
Yeah.
So, just some context for viewers who might not know. The psychiatric campus that I work at is actually across town from the main medical center, which is where the studio is. So, to even get a youth to the studio is a pretty big ordeal because we're trekking across town. The youth we're working with has to be stable enough that we can take them into a new environment and feel that they can be okay with it.
Right.
A lot of the youth we work with have been pretty fragile, and just the change of environment can be a big deal for them.
Well, absolutely.
So when we get kids down there, sometimes with some of the youth I've taken down, that's been my whole goal. I can think of one youth in particular I was working with. They had been hospitalized at our facility for quite some time, and they were getting near the time that they were supposed to leave. And there was a lot of concerns that they weren't going to transition well back into the community because they had been within our structured program for so long. Everything was so predictable.
Right.
So there was concerns that when this youth left and they went back into just regular life in the world where things aren't as predictable and structured, we were concerned that they weren't going to do well. So I worked with another staff. This particular youth had a great connection with music. It was a place where they felt very confident, very self-assured. So we said, let's piggyback on that confidence they have and then use it to challenge them with something we think they may struggle with. So we had this youth come down to the studio and let them record themselves singing some of their favorite songs.
Oh, wow.
Oh, that's
So
amazing.
we were able to expose them to new people. The studio staff were unfamiliar to them. This was a new environment. But we did it in a way that was success-oriented to build up this youth's confidence of you can go into new places and you can be successful there. This youth was so excited. They got a DVD of their performance.
Isn't that
That's
fantastic?
awesome.
Yeah. It just
And then they
makes
got
you smile.
to share it with the people back on the unit when they came back to say, hey, look what I did.
I'm telling you what, that type of thing is really exciting. And then when you see the kids, and it's interesting to me also that not being the person that's working with that particular child and seeing them in the beginning stage and then as
Right.
that progresses and where they are and they're excited about things when they possibly weren't at one time. It's fantastic. And music and your patience really help pull a lot out of that. So let's just yay music.
Yeah.
Do the quiet.
Hey, I know it changes my mood all the time. You can throw an iPod on.
Right.
You know,
heck
and that's
yeah.
like the
and just
simplest, like you were
isolate for
saying, the
5
simplest.
minutes, and it
yeah.
just changes everything about your mood and yeah.
And I think that speaks to why music therapy as a profession is able to be as beneficial
Sure.
as it is. Is the majority of people in society do have some connection with music. Whether it's they love to listen to it, they love to sing in the shower, they love to tap
Right.
out beats on the table, or they're dashboard drummers,
Well, right. It's
Yeah.
everybody. It's
Yeah.
like, have you ever met anybody that doesn't do at least something like that?
Yeah.
Music is so important, I feel like, in everybody's lives, whether they realize it or not.
Absolutely.
Create your own theme song.
Exactly. I've done that with youth before. Or what happens is, even if we don't create our own theme song, if we don't write our own, sometimes what happens is these songs keep coming back up over the course of their treatment over and over, and they become their themes. Maybe they have lyrics that just really express something that reflects who the client is or who they want to be. They just
right.
relate to it, and it does really become their theme song. And, we may record them singing it for them to have a tangible takeaway of this theme song for them to listen to after. So many ways we can go with it.
And a lot of times I think that the kids they can't wait to let other kids listen to it because they want their peers to know what they're doing
Yeah.
too.
They're
which is-
excited about it, and they want to show people they're confident, and
It's
it's
just
just
so
awesome for them to
fantastic.
feel that way.
What
And-
go ahead.
That actually reminds me of another youth that we had at the Seacrest Studio, knowing that some of your viewers may be familiar with that. There was a youth that we had in treatment who did a beautiful job of working through her own treatment issues. She'd had a lot of adverse life experiences, and she got to the point in her treatment where she not only felt good about herself, but she felt ready to give back to the community.
Oh, wow.
She wanted to inspire other people who had been through similar life circumstances and wanted to convey the message that you can get through this. You are not the only person who's been through this, and there is hope. So she was a brilliant songwriter and a brilliant rapper. So I challenged her to create a rap that expressed that. And then I said we would find an audience for you.
Yeah.
So she created this beautiful rap that just expressed a lot of what she'd been through and did instill that hope in others. So her venue was the Seacrest Studio. We took her down there. We allowed her to record what she had done. And then we got permissions from guardians to air it on the Seacrest Studio.
Wow,
That's
you
wonderful.
get to do that.
Yeah,
That's
exactly.
fantastic.
Yeah.
Wow.
Working with people with mental health issues, sometimes there's a lot of stigma attached. Our particular facility does work with a lot of kids in foster care, and so sometimes there's rules around whether or not we're actually able to share their creations, and often
Right.
we're not able to,
Yeah.
just because of logistical issues. But this was one individual who we were able to let her voice be shared.
That's amazing.
And it was huge for her to know that her message could be inspiring and helping others. who
But
were
it's like
going
an
through
awesome way to
difficult-
come like for full circle for them. You know what I
Exactly.
mean? Like starting from a certain point and then wanting to give back, and then that's awesome.
Absolutely.
Yeah.
And if you think of the hero's journey that's present in so much film, literature,
Right.
part of the hero's journey is getting to the point in the journey where you can give back. And so it was beautiful to see her
Yeah.
get to that point.
Do you are there some clients that you work with who aspire to be songwriters or musicians? Because I know that is, I know a lot of the kids that we work with mental illness or with a mental health diagnosis, they're very artistic and very creative, and
Right.
they aspire to these things. Are there some kids that you're able to encourage? Because I know you have been able to even reach out into the community for them as well.
Exactly. So yes and no. There have been some youth that are into it. Oftentimes, given the acuity of the kids that I work with, sometimes thinking that far into their future is really difficult for them. For them, thinking of, can I get through today? Can I get through tomorrow?
Wow.
Can I get
Right.
through this week? Is enough for them. Sometimes I do have kids that really want to make a career out of music, and so we just try to nurture that love, keep it blossoming, even when they're going through these hard times, and absolutely have been able to do that. My big thing with the kids is I tell them that you don't have to be a musician to benefit from music therapy.
Right.
Yeah.
What's more important is nurturing that connection that makes you feel whole, that makes you feel like you can live up to this potential. And it doesn't matter what it sounds like when it's finished. It's about the process of creating it.
Getting there, yeah.
And what it feels like for you, and if you're able to achieve what you want to achieve. Now, if there's a beautiful musical product, that's fantastic. But it's generally not the end goal. And so sometimes there is that focus on the performance and maybe creating music that's going to help them professionally at some point, but not always.
Eye of the Tiger, baby.
Yeah.
Put it on. Let me listen to
great.
it.
Well, I think it's just wonderful. There's so much of that sharing of their own experience, and that I think it also is nice to know that yes, everybody aspires to do different things or whatever, but they can still have a love for music, but not feel like they have to be a rapper or a pop artist or singer or whatever.
Ready to go on American Idol.
Right, that they can just appreciate what it does for them and what they do for music. So that's really fantastic.
This youth in general are not often known for their intrinsic motivation. There's a lot of times
We know that.
with youth that we are using external things to motivate them. If you're able to complete these treatment things, we'll give you this reward or things. But music is one of the places that youth can start to explore things that are intrinsically rewarding and know that they don't have to make money off of it to feel good about what they've done.
Yeah.
And that is huge as you transition from childhood to adulthood, to be able to rely on intrinsic motivation. It's just a good life skill in general, with or without a mental health issue.
And music connects them to their peers when they're in the
Absolutely.
hospital and when they're outside. I mean, it connects us. I mean, if you find someone that likes the same music that you like. Have you ever had a situation where, and I have no idea if this has ever happened, but you had a patient that really, or a client or whoever that really liked a certain type of music, but you decided to introduce them to something else, and they were like, wow, this is really... At least we're willing to give it a try and see if it was something that they wanted to get involved with.
Yes, I do know that's happened. I do some group work as well. And so when you're working with,
Like a bunch of different
6, 7, 8, 9, 10 youth at the same time, sometimes you have 10 different music preferences.
Right.
So especially in the group setting, sometimes we find that middle ground of what is something we can all handle, that we can all tolerate. And sometimes the goal for the group then becomes, all right, first we're going to do music that this person loves and connects with. But you've already said that's not your style of music, so how can you learn to respect and tolerate that person's musical selection? Sometimes that becomes a big purpose of the group.
Yeah, and that's just a great, life skill to learn too, is just to learn where people are coming from, and like you said, when you started that it was the heavy metal, and you really had to dig into why they liked that, and it's interesting. Yeah, that's awesome though.
Yeah, so that has happened. What I find more frequently is the opposite happens. I find a youth that's really passionate about some style of music that I don't know about, and then they're able to become the teacher. They're able to teach me.
Wonderful.
I just got goosebumps.
That is wonderful.
I can think of one youth in particular who was really into electronic music, dubstep, chill wave, things like that. And it was an area of music that at the time I didn't know much about. And this youth taught me so much. And I think it was an empowering thing for him to be the expert on something.
Sure.
When in so many other areas of his treatment, he was being asked by experts to do things. And this gave him that empowerment of, this is what I know about, and I can teach you about it.
That's awesome.
That's cool.
That's fantastic.
And he introduced me to pieces that I still listen to in my
Really?
own free
That's
time.
wonderful.
You have
That's
to-
love it.
you have to
Yeah.
start
Start
introduce
listening
me
to
to some
other
other
music that
electronic.
you wouldn't even realize you would like, and then all of a sudden you're like, wait a second, that's actually really awesome.
Yeah.
So I'm just curious, because I know you play a lot of different instruments,
Yeah.
and you are currently cello?
I am working on cello. This is my newest
cello
endeavor.
is so beautiful.
Still working on my cello skills. It's my newest.
No, that's okay. So
Cello's
what
like my-
instruments do you play? Because I've
So
seen you.
as a music therapist in general, for anyone who's looking to get into that, almost every university is going to have you pass competency tests in piano, guitar, voice, and basic percussion skills. So you don't have to be ready to sit down on a drum set and rock out forever, but be able to use different auxiliary or ancillary percussion, you know, cabasas, maracas, things like that, hand drums, cabasas.
I can do maracas.
Castanets, to be able to keep some basic rhythmic pulses there. Most every university will have music therapists pass competencies in those. And so I do play all those. Do I play them well enough to perform on stage? Not necessarily. But because the skills that you use as a clinician are different than the performance skills you use. So I don't necessarily have the chops on piano to sit down and play Rachmaninoff in front of a big crowd of people. But I do have the skills on there to listen to a drum beat that a youth is playing and improvise an accompaniment pattern to do
it's like a different...
it's a very different
That, you know, it's my big secret passion is to learn an instrument.
Yeah. But on top of that,
you know, like I just like their energy coming on. I'm like, I can do it. Anyway, go ahead.
Yeah, but that's the beautiful thing about music therapy is while those are the core of what we do, whatever you feel competent with and whatever your clients connect with can work in our field. So I've played trombone. I have used that in sessions with youth before. I've used ukulele quite a bit with youth. Banjos, mandolins.
Oh, wow.
We sometimes use electronic music programs like GarageBand
Right.
to create loops like that, which is a very different kind of skill set that you're using. I mentioned voice earlier. Most of our training as music therapists is focused on singing, but working with adolescents, rap has become a big part of what I do every day. So being able to, just drop the beat there and get my flow going. It's a big part of what we do. And really, as a musician, you're able to use your strengths. Yeah. As long as it's connecting with the client in a meaningful way, that's perfect. So, Nancy, if you ever wanted to be a music therapist, you can. There you go.
I could be a music therapist.
She can definitely lay down some.
I just want to.
She's got the sick beats going on.
Yeah, she does.
I got like a ukulele. I don't know how to play it, but I make up songs. I bought a keyboard.
She does make up songs
because I had
a lot.
insomnia and it was on the Home Shopping Network, and I was selling it, and the people were nice. So one of these days, I might have you come over, and I'll go. I don't know. We'll see what happens, but.
And there's so many ways you can make music even without instruments. I do body percussion with my kids a lot. That's cool. Beatboxing.
Yeah, anything.
The possibilities are endless. I've worked with youth who really like using styrofoam cups to make beats. So it's such a creative field, and it's whatever the youth or your clients connect with, and the possibilities are endless.
I love the fact that you can use anything. We have to kind of wrap up here, but I love the fact that you can use anything. It doesn't have to be.
That's amazing.
It can be.
Yeah.
Here I am. I'm going to try to be like Jenn, but I'm not. I don't care anymore if my hair can't get any redder. It'll be better
Be the bad dancer.
if I put more color in it, and I'll win it. I don't care anymore if my hair can't get any redder.
Oh yeah, gotta bring it down.
It'll be better.
Now back to the regularly scheduled program.
I don't know. I like to make up songs. That's the closest I can get.
But I think that again just shows.
But that's
how powerful music therapy is, because people are just so willing to engage in it, even when we're in a different
and everybody just immediately picked up on it and just started getting into it and stuff like that. All right, Jenn Seley, she's phenomenal. I'm going to look at the camera finally because I've been so caught up in what you're saying, because I think you're amazing.
Hey, everybody.
Really, what you do is fantastic. And I just want to tell everybody that the Trifecta, Neapolitan Trifecta, will be live, like I said before, not just the Pulse, but actually there at the Imaginarium
in Louisville,
Kentucky, October.
7th, 8th, 9th.
7th, 8th, 9th, and October this year. So we're looking forward to that. We're going to be doing interviews live, and it's a fun time.
Sponsors. CP Design, Starwind Entertainment, Starwind Vacations, Piebird. Who else? Who am I forgetting? Five Elements Pottery.
Yeah, 5 Elements Pottery.
And who am I forgetting? Blind Lemon. Did I say
Blind
Blind
Lemon,
Lemon?
Blind Lemon, yep. And
Yeah.
a shout out to Lawrence Bloomfield, who's filling in for Rusty. Our beloved Rusty. Lawrence is actually equally as quiet as Rusty as doing sound today. So, Lawrence, thank you again for that.
Although you can hear Lawrence's magnificent voice in the beginning.
Yes,
the
Lawrence
opening
is
of
the voice of our
the Trifecta
So you do
podcast.
know what
The
he sounds
Trifecta
like.
Pod. That is Lawrence's voice. And Lawrence does play blues music. He plays blues harmonica. So, anyhow.
Yeah.
Follow
we
us
should-
on Facebook and Instagram at Neapolitan3. Spell it out. Check out our website at NeapolitanTrifectaPodcast.com.
Yep. Jenn Seley, thank you again.
Yay!
You are fantastic, and what you do is even 10 times more fantastic than
Yes.
you. Anyway, yeah, and she's amazing. So anyway, thanks everybody. Take
Bye.
care. We'll see you soon.
Bye.